I've been asked to speak a bit about our experiences and how they might help you plan for the aging of your tenancy. Project Find has been in the business of providing housing and services for older adults since the late 1960s. From our beginnings, we've sought to create environments where people feel connected, valued, and supported respectfully as they age. Our service model combines affordable permanent housing with services along with a co-located senior center with funding from the Department for the Aging. The Woodstock Hotel is perhaps the most analogous program we have to yours. It's a 281-unit SRO building where nearly 75% of its occupants have coursed through the homeless shelter system, and roughly 25% of them have or are still suffering with substance abuse. The remainder is comprised of very low-income individuals. Our other two buildings are more middle class in feel, even though the eligibility is capped at 80% of area median income. The Woodstock is also where we have assembled the widest range of services. In addition to the social services team, there are housekeepers who enter the majority of apartments on a weekly basis. There's 24-hour front desk coverage, evening and weekend maintenance shifts. We've established partnerships with the Lutheran Family and Health Services to have an in-house medical clinic, and we contract psychiatric services through Project for Psychiatric Outreach to the Homeless. The Woodstock Senior Center, located on the second floor of the building, is a gold mine. It's open 6 days a week, serving breakfast and lunch, in addition to an incredible range of classes and activities. We've got Zumba Gold classes, we've got line dancing, we have strength training, we have sing-alongs, we have arts and class, and even therapeutic gardening. Roughly 90% of the tenancy use that center, and vast majority of them use that center actively. It's very critical for extending their budgets because poverty is another defining characteristic of the tenancy there. In combination, we have created, in essence, a sort of a localized safety net and a network of concerned parties that are attuned to changes in behavior and physical well-being of its tenancy. The overriding goals, and I'll summarize it more quickly, is for all of these combined efforts to support an individual's ability to stay housed and to be engaged in the community for as long as possible against a backdrop of inevitable decline in one's health. The most common age-intensified challenges are the declining health, managing chronic health conditions such as diabetes, arthritis, hypertension, asthma, declining cognitive functioning, poor money management skills, poor housekeeping skills, as well as longer-term medical conditions that may require temporary nursing home placements. I've passed out a chart, and it has a lot of information on it that covers hospitalization data for 1 year, as well as move-out data culled from the past 3 years. The data reinforces the expected. Older people are less healthy than younger generations. They go to the hospital. They're hospitalized in greater numbers. They suffer repeat hospitalizations at greater intervals. It also demonstrates the majority of cases that people either they leave the apartments through mortality, or they decline to the extent at which it's no longer a safe environment for them to stay, and they go to the nursing home. At the Woodstock, it's over 50% of the people that have either passed away or have gone to the nursing home. At the Hamilton, it's 60% have died. And roughly at the Hargrave, it's roughly 45% have passed away, and another 20% have gone to the nursing home. With the declines in health, that's just one aspect. Another aspect to emphasize is that people have a lot of unstructured time on their hands and are hungry for opportunities to be engaged. Tapping into people's desire for company, stimulation, contemporary relevance, and affirmation is where a lot of fun is to be had, and where the dynamics of client and service provider can be reshuffled in very constructive ways. For us, this means community building and seeking opportunities to engage people's strengths and loves as opposed to their problems and their inabilities. We organize annual talent shows and apartment contests where prizes are awarded in the category of most beautiful, cleanest, and improved. At the Woodstock Hotel, and you can go to the final slide, we awarded first place winners two months free rent, and held a public event emceed by Joe Franklin of Memory Lane, the last Memory Lane fame. And this was kind of a really beautiful contest because the judges was a housekeeper, a building superintendent, and a security guard. And we got into people's apartments in a different way, and they got to tell their stories about home and how they solved the riddle of making a 200 square foot unit a diverse home with different functional spaces. It was really quite amazing, and we've repeated this at all of our buildings. Our latest venture is a webcasting cooking show targeted to older adults living on tight budgets. And we're going to be pulling from the in-house talent in our buildings and in our centers for our guest chefs. And we're in the process of developing this program and recruiting and expect to webcast it later this summer. Before concluding, I really want to emphasize how community building can serve as a force multiplier for your programs. Because when you create these contexts for new friendships to form, it lays the groundwork for independent, organic networks of peer support. At the Hargrave, one of our social workers started this weekly coffee group, which has just grown in vibrancy and participation over the past year and a half. And from this, there's new friends that have become aware of each other's well-being, and they go to doctor's appointments together. They conduct visits to the hospital and the nursing home, and they provide a feedback loop of information to the social worker. And this is something that was achieved for the price of tea and coffee. It doesn't cost anything, but it has an amazing amount of value, and it ties in with people's desire to be, useful and connected. So I would really sort of point to encourage people to think of community building as one of those major sort of programmatic thrusts that you should think about because it really yields benefits.